to compute. Hello and welcome to COEHA's month of protecting the health of the healthcare workers in Africa. The month started with the powerful and deeply tragic story of Martha, the young colleague who lost her life caring for others while no meaningful support was there when she needed it most. Martha's story has become a painful reminder of the human cost of neglecting the psychological well-being of healthcare workers and those who care for others. Today, I am delighted to be joined by my good friend and colleague, Dr. Magdi Ishag. Magdi is a very well-known and accomplished psychiatrist who has spent most of his adult life, even before becoming a psychiatrist, working and advocating for the health and particularly the psychological health of individuals and communities who have been affected by trauma and conflict. Majdi has actually just returned from a trip to Uganda where he was supporting Sudanese refugees in Kurindangu. Did I say that right, Majdi?
Yes, Dengo.
Kurindengu refugee camp. Before this recording, Majdi told me some disturbing stories which are not much different from Martha's story. And Majdi's experiences in the past and now resonates very, very well with our conversation this month of trying to protect the health of the healthcare workers in the whole of Africa. Dr. Majdi, it is, as always, a pleasure to speak with you, and thank you very, very much for joining us this evening.
Thank you.
Thank you, Majdi. So, Majdi, I know I directed you to look at Martha's story on our website, and the stories you told me, you shared with me coming from Uganda, as I said, in the introduction, are equally as disturbing. You said to me, the whole situation is absolutely frightening. So before I go into any details or questions, would you like just briefly to tell us what you did there and what you have seen there and what is the situation like?
First of all, just to say thank you for this opportunity to allow me to express and to clarify the tragic experience which is I have witnessed, and living that experience by itself. I could summarize in a very brief statement to say I've been a doctor for over 40 years, and I believe that I am one of the old generation psychiatrists with massive experience to allow me to be able to deal with my emotion and to deal with any situation at the time and distance myself from what I see and what I hear. I could tell you I spent 2 weeks between Kampala and Sita and Kriendengo, seeing many of displaced people and refugees. And honestly speaking, I spent all my session, half of my session, I ended up leaving my clinic to control my emotion and come back to continue. Because it is too much for anybody to bear. It's too much for anybody, no matter what's your experience. The human suffering is unexplainable. Whatever I will explain to you, it's more than a desperate situation. With all the difficulties you can think of, with all the desperate situation you can consider in with your wild imagination, you would never see something as terrible and tragic as I have seen. Uh, what I will say to you, simply, it is a desperate situation. Why? It's beyond
Maybe
any
that is
imagination.
so powerful. Maybe that really is so powerful. And maybe what how many healthcare workers, how many doctors were there, in that camp?
Okay, because I haven't seen the actual figures, and I asked about it from the committee which is organizing the refugees. I asked them about, they told me the number is about 88,000 to 92,000 of Sudanese within that camp, and they managed to register about 400 uh, healthcare worker to
400 healthcare
work, work.
workers.
Yes. And I will tell you, when you attend to the camp, what they offer to you, a piece of a plastic cover and 8 stick wounds for you to create some form of a primitive type of tent, and that will be your shelter with no accommodation. There is no electricity, there's no water, there is no sanitation, there is nothing apart from that cover. And if you are well enough to be able to build a small hut around that and cover it with that type of plastic to be the roof, that will be your only shelter. And if you know that, then there is no water there, there is no electricity, and in the middle of nowhere, and people rely on 10 to 12 kitchens, which is provide some type of donated food. And when I was there, they told me the kitchen has stopped working for the last 10 days because they are running off supplies, and people are relying on their own resources, which they have got no resources at all.
Oh my God. Honestly, Mayday. And Mayday, have you been able actually to meet some of these healthcare workers yourself?
Yes, yes,
Mm,
I have
mm,
managed to, and I will tell you,
mm,
honest with you, I could describe to you many things which could explain the desperate situation they are in.
mm.
First of all, the loss of normalization, the loss
Yeah.
of normality, the persistent stress state they are living in. I can easily describe the level of hyperarousal, the level of anxiety, the level of tension, the unpredictability they live there, looking for the collective trauma, which they have to relive again and again in every day, because it's very difficult to separate themselves. As I told you, they have got the issue of living their own experience, and they're expecting from them to put that brave face and to be care provider. So they are living their own experience and other people experience on a daily basis, which is honestly is too much, because you can see how much there is a clear collapse of meaning and a clear collapse of hope, because they feel desperate. They feel helpless because unfortunately you find that is there is no enough resources for them to achieve what they have been trained to achieve. There is
Yeah, no, maybe. So maybe we have always, the in the normal circumstances, and not in Sudan or in Africa, in the whole world, we look at the healthcare workers as, the caregivers. These are the people who care for others. It must be devastating for these people, as you have said, that they just cannot not only not being able to care for others, not being able to actually, you know, do what they have been trained to do on one hand, and secondly, not even being able to care for their own families, or maybe, themselves as well.
I think there is a cluster of issues. We have to look at them as all as one package. First of all, they have got an issue about their own dual identity. There is an identity issue between being a professional on one hand and being a refugee on the other hand.
Yes.
So you have to put that hat on one situation, and the other hand, they expect you to be a healthcare provider, and which you are at that stage, you are a refugee. you can look into issues like how much they de-skilling because of the lack of recognition, the lack of practice, the issues about the legal issue of how they will practice within that situation, the exploitation because they are refugees and expecting to do things even beyond their own ability and their mandate, the living of trauma on a daily basis without that support from any form of mentor or any form of supervision, and they have to live their own experience and to hide their own pain and suffering to be able to provide. Unfortunately, there is a lot of moral injury there because, unfortunately, they are unable to deliver what they have been trained. And because we are, as a healthcare professional, we have got those, I don't want to call it illusion, but that belief we are able to heal them all, to
Yeah.
care for them all, to provide care for them all the time. When you find yourself, you yourself, suffering, and you are expecting to ignore your suffering and to provide that help, which unfortunately is very limited with the resources, very limited with your own capability, your legal, your professional, and forget about the resources within that, and look into how much of our ethical background on when we practice medicine, how much of confidentiality and autonomy and privacy we have to get over that all the time. When you have to be able only to deliver type of a jungle medicine and to deal with emergency without having the equipment, without having the resources, and sometimes even you ask yourself if you have got the right to be able to
Yeah.
respond to the
Yeah. Yeah.
crisis
Yeah.
is too much of a trauma.
And I suspect, they are the only, resource, the health resource there. So is there a formal clinic where they can practice,
Unfortunately,
or is it, they just being called upon, day and night like Martha?
I think the only problem is there is what is on the paper. There should be a health service there to provide care for that number. But that number is actually become beyond any control.
Mm,
And as I told you, it's within one camp. It is more or less 90,000 individual registered. And no matter what is the Ugandan government is trying to provide is so little, and the demand is so much. The problem is with the healthcare professionals, even if they are not really, most of them, they are not legally are working
yeah.
within the Ugandan system, but they
Yes.
are living within the camp.
Yeah.
They
Yeah.
expect that demand on a daily basis. You know the social culture of Sudanese.
Yeah. Yeah.
Somebody knocking on the door at
And the
three
whole
o'clock
of
in the
Africa.
morning,
Yeah. Yeah. Absolutely.
3 o'clock in the morning, because they know you are a doctor.
Yeah.
You are their only hope. They put that pressure on you. Morally, you feel you have to deliver something. And most of the time, you don't have that something. So that moral injury is going on a daily basis. How they feel helpless, how they feel desperate, how they feel that is they are betraying their own oath to be able to deliver service for the time when is needed.
So this really adds to their actual personal trauma as well.
They unfortunately they have got no time to process their own personal trauma,
Mm, mm.
which is they will question and they will feel guilty about their inability to deliver to their family, to support their family, to look after their own self or their own trauma. They shift that to their own subconscious. And because they are not able to deal with it, they have to be more feeling guilty about not able to deliver on your personal level. And on the top of that, they got their own duty as healthcare professionals to deliver. Although, as you know, nobody would ask them to do anything because they are not professionally registered to
Yeah.
work and
Yeah.
to practice. But you know that is that human side of our profession where you can't send somebody away when you are living in the middle of Africa.
Exactly. Exactly. And if you are the only available resource.
And unfortunately, people look at you
Yeah.
because
Yes.
you are the
Yeah.
doctor,
Yeah.
because you are the
Yeah.
one, and
Yeah.
you are the
Yeah.
savior.
Yeah.
And sometimes even they tax you beyond your ability. You might be the psychiatrist, you might be the heart physician, you might be the chest physician, and it's all beyond your own. specialty or your own ability to work with, but they wouldn't be, and they would say to you, you are better than nothing, or you are just a doctor, you are better than, we just keep that type of trauma to ourselves. Some of them, they will tell me that is, they try to be psychiatrists and they don't know if they are harming people or helping them
Mm.
because they open the wound,
Yeah.
but they can't process it. They
Mm.
don't know any form of therapy to help them to get through it. So they feel, are we damaging them? But they can't push them away.
So you think, Magdi, you think we've got probably a few Marthas in
I would
in the
say to you,
making?
I will say to you, every one of them is a potential mother. Every one of them, because this trauma is going on a daily basis. On every day, somebody knocking on your door and you relive your trauma again. Every day, somebody will cross that boundary to ask you beyond your own ability, and you have got no way to recover or to heal. And you don't have that support from your colleague or your supervisor or any type of institution to help you yourself to deal with your own difficulties. So more or less, it is an accumulation. It is more or less, it is like a pressure cooker. It's going on the daily basis.
Majdi, a couple of years back, myself and with my team, we were in Kenya, and there was had some meetings with the Kenyan Medical Association, and there was a big cry about a couple of doctors who took their own lives, just like Martha, and we had really thoughtful discussions about occupational health is really not a luxury. Occupational health is just so important. Unfortunately, when it comes to psychological support, people do not see it. People look at occupational health when they have, a
Totally
big
relate.
upheaval like COVID or, Ebola or all the nasty things that we see in Africa. Probably the victims, if I could call them that, from psychological injuries in Africa. And unfortunately, Africa is plagued with conflict and wars, and and this affects absolutely everybody. So it has been very difficult actually to organize any meaningful support for healthcare workers, even when things are steady and stable. How do you see, in situations like this, what can we do, from your perspective and from an occupational health perspective?
I think, first of all, we have to recognize one important thing. Yes, we might be worried about them who develop clinical psychological disorder from anxiety, depression, drug misuse, alcohol, or suicide. That is will be something we can say, yes, we can look into that and we can treat them clinically. But my concern is beyond that small group who, because the level of burnout,
Yeah.
who will become more or less mentally drained and exhausted, the number of people who develop that level of habituation, of being able to develop maladaptive type of attitude and behavior, to be accepting working on that level of shortage of resources where you can actually sometimes feel you are harming more than you are giving, but because you have this mental set where I have to do something regardless. When you started to accept the level of violence, the level of trauma, and more or less you lose your own human side in some form of a maladaptive behavior and coping with that level of pain. You have to shut down yourself, you can distance yourself, you become more tolerant to that level of violence. That moral change moral pain and moral disorder by itself, it will change the character and the personality and the attitude of the healthcare worker. And that is really dangerous. That is really dangerous. As we all know, doctor-patient relation, nursing-patient relationship is mainly one of the major therapeutic factors in management. And when you lose your human side in that, because you yourself are become develop a maladaptive type of behavior and attitude, that is dangerous. So what can we do about it? The first of all, we need to recognize that we have got an issue.
Yeah.
First of all, if you don't recognize it and accept there is an issue, then with that issue, first of all, we need to organize some way of them to deliver their expertise within that level of resources, within that level in that country where they will feel recognized, they know their limitation, they would be able to work within a normal condition where they have got their own private time for their own self, so to heal and to recover. And at the same time, we need to have a service of support where they would be able, some form of a mentor or a therapist, where they would be able to help them to relieve, to ventilate, and to re-experience what they have done and to be appreciated for what they have been doing. Because the most worrying things, they will come to a point when they feel sense of helplessness.
Yeah.
And
Yes.
that will be the turning point.
Yeah, absolutely. Thank you, Mayde. Mayde, you probably know this current horrible war in Sudan, the impact on healthcare workers has just been absolutely beyond belief. I'm not talking here about, the physical destruction of the healthcare facilities and I'm sure our colleagues in the Sudan's Doctors Union would have statistics about how many healthcare workers have lost their lives. But you know very, very, very well that fairly, at one time, doctors were targeted by both warring parties. And it was so difficult to just, declare that you are a doctor. I know some of the young colleagues who were actually protected by their communities because they were looking after the communities during the war in Khartoum, protected by the communities. And some of these people are probably within that camp. So they carry that trauma with them and they've got the added trauma of having to deal, with traumas of the others. Another really, really horrible situation, which is, leading to hopelessness again, is, just the loss of, you know, not career. It's just it's a complete loss. There are more than 10,000 doctors who have had their internship, discontinued.
Yes,
They are not doctors. They cannot go and register in any medical jurisdiction. They cannot practice anywhere, and they cannot finish their internship,
yes. I will
which
tell
is
you.
a huge
Ye-
problem.
Yes, where this is coming from their personal pain. But I will tell you one of the major areas of pain, as described by one of my colleagues there. He said to me, the most painful thing that sometimes when you are in a situation when you know, but you are not able to deliver,
Yeah,
when you got somebody in front of you suffering and you know what is happening and you know you can make a difference, but you are not able to make the difference. He said that is the most painful experience, which sometimes you would rather die and not to be
yes,
seeing
absolutely.
somebody in front of you who
Yeah,
is suffering. He said sometimes it's so simple. Somebody with an asthmatic attack, somebody who's been have been stung by a scorpion or by a snake, or somebody have got a simple fracture where you know what the basic things to do,
and you
but
haven't got the resources.
you don't have anything to do apart from just looking at them. And he said that is the most painful. He said, I would rather know nothing because I wouldn't have any form of moral obligation that I
So,
should give.
so really, there is a different level to this. So part of the support got to be, at least for these guys, who are there in the camp, at least, we advocate and work with our colleagues in Uganda, at least, to actually formalize what they are doing, acknowledge it, and provide them with support. We've got brilliant colleagues in Uganda, actually, and I really hope I'll direct them to, watch this video, and I will speak with them. Another important thing, Magdi, I think you said it. The most important thing to provide any support is to organize.
Yes.
Without
I
organizing, you
I would
know,
say one small things. I put a suggestion for the Sudan Doctors Union in UK and Ireland, and I told them one of the issues. I went there and I did a few clinics, but my major issue was the continuity of care.
yeah,
Is coming and giving and going is not enough. Although there is one old Sudanese lady said to me, just to find somebody who speak my language is a 50% of my recovery.
yeah,
And
yeah,
I felt that's good. But is on a personal level, it just might be touch some of my own ego. But the reality is, I told them, I wish if there is a chance, there could be one clinic run by one of those organizations like the Sudan Doctors Union and organizing all the health professionals there through registering them through the Ugandan Medical and Nursing
yeah.
Council and give them a role so at least they can be able to run that facility. It gives them that sense of identity and sense of confidence and sense of belief and the moral value of being able to deliver. And at the same time, you can be able to organize any level of support to them and to help them to challenge any type of difficulties they might face. And at the same time, you can give them the time for their own self. So they know when they are practicing and then when they have their own time to recover and to heal and to be just a normal human being without that obligation themselves. So, yes, the starting point would be a focus of organizing the service through some form of an NGO or an organization, helping those health professionals to work around. Most likely, they will be happy to volunteer their work there at least a few hours every day, and that number could easily run a clinic on a daily basis because they would know at least they would be able to do what they have been trained to do, and they would love to do it.
Thank you so much, Maidi. The next time you're going to Uganda, we'll put you in touch with David Okello. I hope he watches this video. He is a senior physician, public health specialist who's just retired from senior post in the WHO, lives in Kampala. I'll make sure that he gets a copy of this video, and I will get you connected with him. Thank you so much, Maidi. We will continue, the conversation. I think, this is just opening, the Pandora's box. Martha's story, uh, deeply disturbing and horrible, but, your experiences are equally disturbing. Thank you very, very much for
Thank
being
you.
with us today. And I have absolutely no doubt, maybe, that we will continue to work on this together, at different levels. Thank you
Thank you.
very, very much.
Thank you, Omar. And I believe that Ismail's story should be at least a light to guide us towards not for anyone to live that experience again and to honor her soul and her dedication by trying to minimize that level of harm which health professional might be suffering and living that pain in silence without reaching that point which is we are all concerned about. Thank you ever so much, and I'm more than happy to help and contribute to any way to help in providing a better health care services for Sudanese refugees wherever and wherever. Thank you
And
ever so
thank
much.
you so much, Maidi.